in the Manila Bay and other bays that experience red tides, it is the marginalized that is affected in health and in economy.
Engineering is the ability to absorb, thrive, and then recover. The faster you're able to recover, the more resilient.
Sa Pilipino, ito ay katibayan at katatagan sa mahirap na sitwasyon at ang kakayahang bumangon muli.
Yung ecological naman, the ability to adapt. Yung evolutionary resilience, Vale, to really innovate and be creative.
Resilience is really being able to spring back from adversity, but it should have learning, and therefore it strengthens you to be more resilient than before the adversity came to you.
Before COVID-19, the Philippines was already on to SMT-based measures to improve its resilience capacity. With COVID, the country was awakened to the need for resilience of our economic, health, and educational status as well.
The country as a whole is, I think, not so resilient because while we have the capabilities, the opportunities, and the resources to cope with COVID-19, the whole body is suffering because the leadership and management is not working so well. When it comes to individual resilience, those who have more resources, capabilities, and opportunities will be more resilient than those who are not.
A lot of the problems really may be interconnected, Vale. You have to look at it from a holistic point of view. It encompasses more than natural sciences or physical problem, Vale, but also it gets into the ecological, biological, as well as social panga.
Among issues and problems we have are poverty, ecosystem destruction, climate change, and variability.
Much of our attention is placed only after the disasters happen. What we should do really is to take early action years before the hazard strikes, and we should put our attention and our resources into that type of planning.
We need SMT-based transdisciplinary and inclusive approach to coping with possible hazards.
The fragmentation of society needs to be resolved for resilience.
Communication is very, very important. And we should communicate to the people using not just scientific communication means, but through arts, music, understand the mindset of the Filipino people so we can communicate better.
Well, the way to move forward is interoperability.
So we have to do a lot of work as a person, as a community, and as an institution to really have resilience as one of the values of the Filipinos. Yung tunay na resilience na towards improvement.
Building resilience requires sustainability science inspired by transdisciplinary approach.
To be sustainable, you have to be resilient. To be resilient, you have to be sustainable.
Go natural. Go with nature's flow. Non-structural or natural interventions, as well as good planning, is the most sustainable.
Finally, we need to harness and strengthen the Filipino spirit of bayanihan.
Magandang hapon po sa ating lahat and welcome po sa lahat ng mga guests natin ngayon and especially sa ipapakilala ko mamaya na ating resource person for this afternoon. Magandang hapon, Luzon, Visayas, Mindanao. Ayan na naman, nandito na naman tayo sa ating ika-22 or 22nd episode ng Kumustahan para sa maganda, maayos at makabuluhang kinabukasan. Isang oras na naman po ito ng hitik na talakayan ng mga usapin na talagang napapanahon na kailangan nating mapagtuunan at malaman ano-ano ba itong mga ito at anong magagawa nito sa ating kinabukasan. Kagaya ng mga naging topics natin ng mga nakaraang buwan, nakaraang linggo, isa na naman po itong interesting topic, no? Pag narinig nyo yung title niya, parang siguro kung kayo isang may bahay, parang hindi natin ito masyadong naririnig. Pero mamaya, talagang detalye, malalaman natin ano bang ibig sabihin ng topic natin sa hapon ito. One Health and the Emergence of Zoonoses in the Animal-Human Environment Interface. Ang atin pong panauhin sa hapong ito, eksperto po sa sinabi kong topic na ito. Siya po ay currently the Global Health Security Advisor ng USAID, GHS Philippines. Meron po siyang doctoral degree from the University of London, Royal Veterinary College, and the master's degree with distinction. Yan po, with distinction from the University of the Philippines. He specializes on emerging pandemic threats at the animal-human environment interface, o yung tinatawag nating One Health, no? Mamaya nga malalaman natin yan. And whole of society IHR-based pandemic planning. He was the World Health Organization veterinary field responder during the early outbreak of avian influenza in the Southeast Asia. He also supported ASEAN's pandemic preparedness from 2006 and co-developed its ASEAN Public Health Emergency Coordination System and Zoonotic Disease Prevention from Wildlife Trade Policies and Strategic Plan in 2022. During the pandemic po, he supported the FAO as Regional COVID-19 Coordinator. So talagang napapanahon po na makausap natin ang ating resource person for this afternoon. He was formally connected with the Philippine Research Institute for Tropical Medicine, where he pioneered One Health collaborations on rabies and Reston Ebola virus. He has worked in preclinical drug development and toxicology. He was presidentially appointed as the veterinary board examiner in 2004. He now serves in the World Health Organization Simulation Exercises Technical Advisory Group and is a member of its country simulation exercises and reviews an operational roster. He is a member of the World Veterinary Association, One Health Working Group, a fellow of the Philippine College of Veterinary Public Health, and member of the Philippine American Academy of Science and Engineering and Asia Pacific Center for Security Studies Alumni. Sa mga binanggit ko pa lang, talagang alam na natin na marami po tayong matututunan sa hapon na ito, kahit short lang po ang ating oras. Let us all welcome, and we are very honored po na nabigyan tayo ng pagkakataon na samahan tayo sa hapon na to. Please welcome Dr. Noel Lee J. Miranda. Hi, Dr. Miranda, and good afternoon.
Good afternoon. Good afternoon po. Good afternoon to everyone. Pleasure to be here. I'm so happy that I'm taking part in Future Earth Philippines endeavor. An opportunity to provide some understanding about One Health. Would you like me to?
Yes, you can share your screen
okay.
If you have a presentation, sir. Thank you so much.
So I'll start my presentation. There you go. I'll just remove. Okay. Well, this topic is indeed, I guess, new to many, not everyone. And it's been made more familiar after COVID or during COVID and until today. And many organizations support One Health, promote One Health. And in the Philippines, that's the reason why I'm actually working as a advisor for USAID Global Health Security project in the Philippines. I work closely with the Department of Health, also partly with the Department of Agriculture and DNR. So let me, the title of my presentation actually has connected to the preventing the pandemic or preventing the next pandemic. And so hopefully there will be no next pandemic. So that's also one of the reasons why we're talking about One Health today. Okay, this is not moving. Okay. SARS-CoV-1, it's been 20 years since we have been visited by this deadly virus. It's SARS-CoV-1 because 2 is actually the present pandemic. And if we look at it, it started in February around 8 to 11 in 2003, when it was thought it was a deadly flu. And a lot of people started, my cell phone and people were actually sending short messages through their mobile phones. And on February 10, it was started, the media had picked it up, and there had been a lot of rumors in the media as well, and panic started to take place. But it was in February 11 that it was actually, finally announced officially that there is in fact a new novel virus, which is then called SARS. Hindi natin tinawag na SARS-1 yan because wala pang SARS-2 noon. And so when we talk about, I'd like to actually frame this presentation from the point of view of global health security. And when we talk about One Health, we cannot talk about it without talking about global health security. Global health security is a simple concept. It's actually, when you say global health security, it's not entirely all about, the health aspects, but it focuses on global health threats, in particular pandemics, anything that actually would be associated with a potential to become a pandemic agent, whether that's viral or bacterial. But it can also mean AMR. It can also mean food safety concerns, and it can also relate to other threats that may not really be, showing pandemic potential, and it may not necessarily be a zoonotic disease, like, for example, ASF. I would consider that as a global health security threat because it impacts on food security. So don't think about global health security as being too confined. There's also the CBRN, which is now involving not just biological agents, but also chemical and radionuclear. Okay. So, but all of those threats actually have one thing in common. One, there's the opportunity to prevent. There's the opportunity to detect the threat early, such as a zoonotic spillover, and also the opportunity to respond rapidly to mitigate and control the threat or the risk. So now I'd like to say that we cannot talk about global health security or the global health security agenda without putting it in the context of the International Health Regulation 2005, which have the following basic purpose or purposes and scope. Number one is to quickly detect, prevent, mitigate, and respond to severe disease, public health event or threat, which can potentially or is potentially a public health emergency of international concern. And also, next is to assess and notify within 24 hours after verification the WHO, and therefore, trigger the prevention of international spread across borders and the interference with international traffic or travel and trade. And of course, harness a coordinated international response through WHO. And I don't have to talk about this so much because we all have experienced COVID-19 in our lifetime. We are still in that pandemic. The pandemic has not been declared over. And so that's exactly what it is. The HR 2005 is actually centered on those important kind of responses or reaction to threats. The focus, I'd like to emphasize, is early detection and reporting to allow for a public health response before international spread occurs or to minimize global impact of an outbreak. Therefore, prevent a pandemic. Now, let's bring in One Health into this picture. Let's examine it some more closely. One Health approach to global health security, right? So, therefore, it is an approach, but it is a very relevant approach because we think that if we do not set in place One Health, or we are not able to organize ourselves as a government or as whole of society to actually respond or prevent threats or detect threats in following the One Health approach, we may not be as effective as we would like to be. So global health security programs invest in One Health because the well-being of humans, animals, and environment are inextricably linked. This is to strengthen the capacity of countries to address zoonotic disease. Okay, I'll focus on zoonotic disease in this presentation. In particular, zoonotic spillovers at the animal-human environment interface, strengthen national laboratory and surveillance systems, train health workers in One Health, and improve risk communication, as well as, of course, focus on antimicrobial resistance. Now let's contextualize everything. I talked about global health security. I talked about international health regulation, IHR 2005 in short. Let's look at that. How do we frame that? If we, imagine IHR 2005. This was practically the time when One Health was just new. It was not being talked about as much as we are talking about One Health today. So you will not see the wording of One Health, I believe, in the 2005. But APSED now in APSED 3, the Asia Pacific Strategy for Emerging Diseases, was also formulated around that time in 2000. In fact, even earlier, 2004. 2004, I was working with WIPRO, WHO, Western Pacific Office and Regional Office. And that was the time when IHR was being drafted, as well as the APSED, almost in parallel. And now APSED 3 has been revised at its third revision. And it includes, of course, zoonoses. It has included zoonoses, but more wordings related to One Health, more descriptions about One Health approach. And so if you look at One Health, it has all the components of prevention, detection, and response. In particular, I would mention to you or inform you that there are actually two aspects when it comes to prevention. One is what we call the upstream prevention. The other one is the downstream. Now, I'll probably ask that question to you because I'd like someone to answer that from the audience. But along my presentation, I'll be talking about what is really upstream and downstream. So now, the global health security, IHR, One Health are actually now components of the bigger system of preparedness and therefore capacity building that is being monitored through the WHO monitoring and evaluation framework, which includes the JEE tool. At this stage, we have the JEE 3rd edition. This is the Joint External Evaluation Tool. It's an evaluation tool that is actually done every 4 years. And it's voluntary. Countries can invite external evaluators to evaluate their capacity building, the progress and state of preparedness in relation to preventing pandemic threats or zoonotic outbreaks. And under prevention, you have 19 technical areas. And under prevention, you have, in particular, several. I will not go into the details, but of course, you have their antimicrobial resistance, zoonotic diseases, biosafety and biosecurity. Under detect, you have the laboratory, surveillance, human resources. And under respond, you have health emergency, risk communication is actually also here under respond. And of course, the important aspect also would be the technical area in points of entry and border health, which also include chemical events and radiation emergencies. So, what factors are increasing zoonosis emergence? There are, obviously a lot, and this is again giving you an idea of the upstream prevention of zoonosis or emerging infectious diseases. One would be deforestation and other land use changes. Another is illegal and poorly regulated wildlife trade, climate change, intensified agriculture and livestock production, and antimicrobial resistance. Before the current pandemic, the World Bank and UN Environment Program estimated that an annual investment of 1.9 to 3.4 billion US dollars in strengthened One Health systems would yield an annual global public benefit of over 30 billion US dollars annually. So why not invest in One Health? So that's the reason why we need to talk about One Health more and more, in particular as it is applied or relevant to upstream prevention of zoonotic spillover. Now, if you look at this slide, it actually depicts to you the causes and effects of potential emergence of zoonotic events. So biodiversity loss and ecosystem degradation drive disease, zoonotic diseases. And looking at the picture here, you can see that in the green, you have the unstable setting and risk. And in the brown, where you have the hunter, and this could be referring to indigenous people or local communities that that live in stable setting and risk. In other words, they've been living in that situation for so many years, and we consider their situation to be stable in terms of the risk. unless, therefore, if there would be disruption, whether that's natural or man-made. And the following, you have drivers of sudden dispersal of animals and indigenous people from stability to instability. You have climate change, you have disasters, habitat degradation, urbanization, competition, poverty, and food insecurity. And of course, I did mention, for example, which is part of urbanization, also the expansion of agriculture. So urban wild meat demand can also drive, the hunters who are hungry or are living in poverty would need some income, and they are driven by the demand by urban wild meat, people eating wild meat or buying wild meat, either for luxury or for, sometimes they like to taste, just curiosity. They want to taste what wild meat is like. So the hunters would transport the animals to the market, and we have such things as live animal markets in many places in the world, particularly in Southeast Asia, Africa, and of course in many other places. But in Southeast Asia, I've visited a number of live animal markets way back in 2004, 2005, when I was with WHO, and also I investigated or surveyed the live animal markets in places like Vietnam, Laos, and Cambodia, and China as well. So now let's talk about the animal-human environment interface. What is this interface? So the interface is, I would define it in simple terms. This would refer to the settings, conditions, and means enabling zoonotic disease risk entities to inadvertently interact directly or indirectly. And risk entities include humans, animals, microbes, and vectors. Now, infections in animal populations could be in the free-ranging situation or in captivity or confinement. Free-ranging would refer to communities where you have stray cats and dogs, for example. They could be near hospitals or markets, monkeys in the temples or plazas. The forest and jungle would also represent the free-ranging condition, all hunted species, and also bats. They live in the forest. Now, captive and confined animals would be those found in the households, farms, markets, laboratory animal facilities, zoological facilities and parks, rescue and impounding facilities. So these would be where potential infections in animal populations could happen. And I would say that infections mean there would need to be interaction. Therefore, we're talking about the interface, right? We're talking about the interface where there are animals, there are humans, and within a certain environmental condition or a environment where that interaction could actually be facilitated. So animal case-initiated risk pathways, in simple terms, you have animals that are in the farm, live animal market, households and community, and holding, transport, enclosure. You have animals, there are all types entering the food chain, and this would be where potential infections could happen. And then human case-initiated risk pathway would mean humans engaged in farming or any of those animals, taking care of any of those animals that are in different confinements. Also hunting, transporting, and inspecting animals. And so you would have animals exposed to humans And therefore, in a way, this is a kind of reverse zoonosis. And then the animals that would be infected from humans could infect other humans or humans. So what is a good example of this? For example, monkeys, tuberculosis in monkeys. Measles is also a possibility. Humans infecting animals with measles. And of course, SARS-CoV-2, SARS, could also come from humans. And that's why we're watching out for spillovers, right? We're watching out for zoonosis as well as reverse zoonosis because of the widespread of the virus circulating in the community. So the animal-human ecosystem interface threats to global health security would necessitate a One Health response, and One Health is defined most recently in 2021 by the One Health high-level expert panel. And this is a very good definition. It's accepted by many. But I'd like to focus on three aspects of this definition. One is that all sectors should jointly address threats to animal, human, environment, health. So all sectors, relevant sectors, should jointly address the threats. It calls for collaboration, communication, and coordination. So this is what I call the 3 C's at all levels and across all sectors and actors. And it should advance IHR objectives. So the picture speaks very well about how One Health is defined. And I'd like you to visit the definition because the definition has a publication, and there you can read about how it's explained more in more detail. So here is a multisectoral One Health system. I'd like to explain. Betsy and I, my wife, Betsy Miranda, you all know her. We had published this recently as well. So this came out in the recent publication that we had on zoonotic spillover. So you can see the multisectoral relationships, and the center of this approach, One Health, would be the zoonoses and hazards, focusing the causes and focusing on the impacts or effects, and looking at the risk and vulnerabilities of exposed animals, individuals, humans, and the environment. And it requires integrative education, research and development, integrative management and communication, and inviting, governments, inviting NGOs, non-governmental organizations, civil society organizations, the academia, and the industry. So I won't go into the details, but the health sector, well-being, social sectors, sociocultural, ecological and industrial, and governance or government, or for example, the local government units in the Philippines. Ecological and industrial, I put this together because of the relevance of industrial impacts on ecology or ecosystem. And I think the ecosystem is actually degrading or is actually being kind of disrupted, including biodiversity loss, is because mostly it's because of man-made, man-driven or man-induced, human-induced impacts or causes. And of course, there are natural disasters, natural causes, but we can control what we actually induce as human beings. So One Health within the IHR framework, I'd like to give emphasis to the fact that we're looking for, doing things jointly detecting and assessing zoonotic outbreaks, jointly mitigating and controlling disease spread, jointly making critical decisions on reporting to WHO within 24 hours, and jointly enabling One Health system. the mechanisms, human resources, and the 3 Cs. And therefore, we have a joint preparedness plan in place. So the word joint or jointly is actually so meaningful. You know, let's all embrace that. It's important. And it's a big challenge because it's so easy to say jointly, but how do we do this? How do we do this when many of us are actually, you know, quite comfortable? We're working in our isolated silos, you know, working with our funding, our budgetary framework, within our budgetary framework, you know, and also we're actually sometimes competing for funds. How do we actually work jointly when we are so used to working separately? That is a big challenge. It's like also, to me, the challenge is or a challenge among people that have to actually try to live together. But it can be a relationship challenge because it's not easy for people to actually relate to each other. And that's why I'll explain to you in a while. There has to be a very important consideration and also strategy for us to actually work jointly together, you know, helping each other. And so One Health aspects that are not explicitly within the IHR, well, it's really the prevention, the upstream, you know, prior to detection of zoonotic spillover events. The prevention, where we are talking about disease X, we're not sure of what's out there and what we're going to detect, but we're actually preventing the emergence of disease X, which we call this zoonotic spillover in the animal-human environmental interface. So at source or upstream. That's the whole meaning. So it's all about what? 3 things I would summarize. Climate change, you know, working towards preventing climate change, working towards preventing biodiversity loss, and in general, ecosystem degradation or disruption. So upstream One Health action points, I'd like to go over this. This is important. I've highlighted in bold letters to understand the drivers, including ecosystem degradation, land use, habitat change, environmental and climatic factors, as well as harvesting, farming, and the trade of animals. Develop risk mitigation measures, including the maintenance of resilient, healthy ecosystems, early interventions aimed at reversing or halting environmental degradation and biodiversity loss, and the regulation of farming and trade in wildlife and wild animal products, and the reduction of spillover risk, and enhanced sustainable and targeted One Health surveillance, early warning, and response mechanisms in ecosystems. Further, the World Bank, of course, says that prevention is a foundation for global health security and improved development outcomes at much lower societal and economic costs. Focus on disease X, right? Let's focus on disease X, meaning we don't have to wait. We don't have to wait for disease X to have a name. Manage land use again, expansion of agriculture, wildlife and livestock trade, and the production and consumption of wildlife, and pollution control, especially in critical animal-human environment interfaces. The long-term outcomes, of course, that we would like to see would be improved ecosystem and biodiversity protection, energy security, and rural and urban development, and more resilient communities. In the beginning, we saw the footage or the video where we talk about resilience. what is resilience? To me, resilience is actually foresight. Depends on our foresight. If we have good foresight, then we know what to prepare for. We know what to prevent. And we know that we do not need to actually have to face another pandemic because we were able to successfully prevent it, right? So resilience is not really trying to face the adversity, but it's actually preventing adversities in the first place. So the post-2020 Global Biodiversity Framework, which was recently in the COP15, they talked about this. I'd like you to look this up because this Global Biodiversity Framework is very, very important when it comes to our work, not only in One Health, but also planetary health. Now I talk about planetary health. It's actually now relating to One Health, and maybe there would be some questions about this. But let's just say that to prevent future pandemics and other important health security threats, such as food insecurity and climate change and natural disasters and their impacts, are actually both relating to One Health and planetary health. So efforts include poverty reduction and food and livelihood insecurity, especially involving the local and indigenous communities most impacted by biodiversity shifts. So I don't know if you've heard of the FEP-SDG. It's the Philippine Interagency Committee on Zoonoses. This was set up under a administrative order. It was first an administrative order under Nonoy Aquino, and then President Aquino, and then it was upheld or continued on by President Duterte, and now the FEP-SDG will have its meeting in 2 weeks from now, and this is the interagency committee that involves the health sector, agriculture or animal health sector, and environmental health sector, represented by the DE&R department. So the FEP-SDG is important for sustainable institutional, legal, financial, and capacity and workforce development frameworks for One Health actions. I would encourage our country, the Philippines, to actually enhance legislation. And I would encourage that we come up, formulate, or file a bill on One Health Security, or an act, or a One Health Security Act, or a Global One Health Security Act. So preparedness outcome indicators that I'd like to point out, and I'll just go to the more important keywords: legislation and policies, mechanisms, One Health mechanisms working jointly together, people to actually want to help. We need to encourage people to actually want to be helped, to receive support or help from others. Global health security workforce, we need to build this. And there's a very important group that we call PhilOHUD, the Philippine One Health University Network. I'm sure some of you are here. This is a very important network that we need to support. The detection and response decision-making mechanism is important. Regular monitoring and evaluation, not only through the JEE, but through simulation exercises. We need to have we need to have the mechanism of being able to monitor progress, monitor outcomes, and evaluate and learn, continue to learn from these evaluations. Of course, simulation exercises is part of the evaluation process to test prevention, preparedness, and detection and response plans and SOPs. And moving forward, as I said in the recent publication, is to actually mainstream zoonotic spillover prevention at source in regulatory frameworks, in our mechanisms, and in our evaluation frameworks as well. So just if we still have time, and I think we do, I'd like to talk about a bit on workforce development, but just very quickly, I just want to say that, the whole should mold the professional, and rather than the professional molding the whole. Now, I don't know what you think this means, but I will ask you if some of you would like to answer. But the whole should mold the professional rather than the professional molding the whole. So One Health expert, what is a One Health expert? One is he should understand the 4 C's. Included in the communication, collaboration, and coordination would be capacity building, being able to solve problems, being able to learn from evaluations and improving on the system. So One Health policy and advocacy is a very important expertise. So understanding socioeconomics and business. The One Health expert should understand environmental and ecosystem sciences. And most of all, a One Health expert should be a systems thinker, okay? Think systems. Okay, it's a systems approach. So that's, I think, something that's why One Health is so difficult to actually set in place, because sometimes we think in systems, but we don't actually understand the whole system. Because for you to actually come up with good approaches and good plans, you need to look at the system as a whole. And I think we have alluded to this, and we have alluded to the fact that we need to work together, multidisciplinary, transdisciplinary approach, and also as a whole of society. So One Health education guiding principles. University should promote nature protection in all its relevant curricula. One Health education should not be just science and technical. It should not be traditional public health education. The modernization of higher education curricula and methods of instructions should be undertaken with a sense of urgency, because devastating pandemics are real. And I encourage everyone here to actually feel this emergency. Let's all have that sense of urgency. And that's why I'm so happy. I mean, I'm not happy, but I take this opportunity to actually give you this presentation, because I see that we are in an emergency, still in an emergency. And in fact, we might face a bigger emergency in the coming, I don't want to say in the coming days, but in the future. And One Health education core competencies, I think I would skip this. But to the universities, people in the universities, I'd like to be able to have the opportunity to work with you in establishing One Health education in the Philippines. This is something that's very close to what I want to do, what I want to support. So that's the reason why I mentioned that the PhilOHUN is important, because they're about to come up with a structure and mechanism and program and plans and approaches to, I would say, the new way of educating our medical students. And I would say also, I'd like to offer, I think we should offer One Health education undergraduate in undergraduate studies. And think about, a BS degree, for example, a BS degree, not necessarily calling it One Health, but a BS degree in global health security, for example. I'm sure many people would like to take this up. It's just a BS degree. You don't have to be, it doesn't have to be a doctoral, but it's something useful to society. And it's something that we need. We need these people. We need these graduates. As opposed to, well, not as opposed, but in parallel to public health education. So I'll skip this, and just focus on this. This is the One Health education functional outcomes. I can give you a copy of this. And looking at this, you can see prevention, mitigation, prepare, respond, detect, and notify. And at the center would be what we have, One Health Education, where at the right side, you have One Health policies, the 3 C's, program and data management, monitoring and evaluation, planetary health is there, and systems thinking. On the left side would be surveillance, our science, technical, epidemiology, risk assessment, communication, public engagement and behavior change, biosecurity. At the center, you can also see who are the stakeholders. And at the bottom, you have here season. I think some of you who may have heard my presentation before or in some other forum may know what season means, but maybe I can ask you later in the discussion what season is. What does it mean? It's an acronym. It's an acronym. So at the very core of One Health's communication, coordination, and collaboration is actually human relationships. Let's create more opportunities for stakeholders like us to know what's going on, to know, from each other about One Health and about the issues of global health security. To trust each other, to trust other sectors, to trust the outcomes and work and efforts of other stakeholders, and to support each other. So I'll end my presentation here by saying that one sector alone cannot address global health security risk and complexities. We need to work together, jointly. Thank you very much.
Yeah, thank you so much, Dr. Miranda. Nako, napaka-interesting. Pero Dr. Miranda, kanina may question po dun sa Q&A box, but you were able to answer it already. The 3 C's of global One Health, yung collaboration, communication, and coordination. So, nakita narinig na nung nagtanong yung sagot nyo, no? So, kung kanina, yung parang na-gets ko talaga sa presentation is that you were trying to influence our government.
Okay.
Specifically, we're talking about the university, no, na yung may mga guiding principles kayo on One Health, ano yung dapat gagawin, may mga suggestions kayo na talagang napakagaganda, no? Ang question ko lang po paano nyo dinidisseminate itong information na binigay nyo sa amin ngayon? Kasi kami, ngayon lang namin talaga to, no? Maybe na partner na ba kayong university, or have you conducted outreach, information dissemination activity with universities of your choice, or paano ba? And you were only talking about the government and the universities. How about yung mga people in the community? Are they entitled to know all about this information that you also told us?
A lot of good questions, and we continue to struggle doing One Health as soon as possible, sooner than later, as fast as we can. I just came from Tacloban yesterday because we went there to actually assess what's going on at the LGU level, right? Because of our decentralized government, our policies at the national level can only go down as far as the regional, right? That's where the national government ends. And going down at the LGU is a struggle because there could be political hurdles, challenges. Economic as well, there's budget competition. There's actually prioritization that you have to deal with. They have other concerns. Food, maraming nagugutom, maraming naghihirap. People are more concerned about, what to eat.
The everyday struggle.
And there are other diseases, right? Not necessarily diseases of pandemic potential. There's cholera. In fact, pandemic na nga ito, no? Pandemic na nga yun, TB, tuberculosis. So how can you tell them, focus on disease X, when the more real disease is actually here, they're facing, right? So disease X is a concept, becomes a concept. So how are we doing this? We're starting to work with the PhilOHUN. This is UP is involved, UP College of Veterinary Medicine. This is so far a collaboration between the medical schools and the veterinary schools. And there's a number of veterinary schools that are already a member. PhilOHUN will have its workshop next week on March 28th, two-day workshop. This is the time. It's like an introduction. It's a kickoff, and this is something we look forward to because it's a very important workshop. But the stakeholders, are plenty beyond the university, beyond government. Of course, there are the NGOs. There's the industrial sector, the private sector groups. We have to reach out. Community engagement, advocacy. I've been talking about advocacy. In Tacloban, we said, look what's happening. I would say less than 10% know what IHR is. When you ask, what is IHR? What is global health security? What is One Health? Oh, I'm sorry, I don't know. It's the first time I've heard of it. Yeah. So then you cannot go further, right? You cannot go about talking about collaboration, communicate, all of these things. But you need to explain to them first the basics. Why is IHR 2005 so important? Because the Philippines is a signatory, it's a party, it's a state party. They are a member of WHO and also part of the IHR. They assume or are obligated, they observe the obligations stipulated under IHR, which is to prevent, detect, and report within 24 hours to WHO once the disease is verified, and respond, of course, under the coordination system of WHO. So I hope I answered your question, but I know there's more answer that I should give you, but
yeah,
it's something that we...
But it's very important po talaga how we communicate this to the people, no? Lalong-lalo na, you mentioned, first time ko lang narinig yan. I'm sure sa mga guests po natin ngayon in Zoom, baka first time din nilang narinig.
It's something that we should keep on talking about, okay? It's something that we should continue talking about.
Po namin kayo uli so that you will talk about it again here. So there's a question here sa ating Q&A box. Paano po makakatulong ang binabanggit niyong 4 Cs sa pagpapaunlad ng health system sa bansa? Salamat po. Ayan.
Well, basic yan sa multisectoral relationships. Communication is basic. Coordination and collaboration. This is basic call. It's a basic call for action. Let's work together.
Pero sabi nyo nga, Doc, yung mga gobyerno nga, ang hirap nga nilang kausapin. They don't talk to each other. So there must be a way. Baka yung One Health mismo, they should also,
Hindi naman sila, I wouldn't say they don't deliberately want not to talk.
Mm-hmm. But collaboration.
They want to, but traditionally we are built to do things our way, right? In our own little silos. Traditionally, it's not so much that they don't want to. It's that it takes mindset change. It takes a behavior change and advocacy to make people talk. Okay. It needs a system. It needs a mechanism. We need to write that down. It needs SOPs. It needs a plan. It needs a protocol. Things have to be written down. Pag-usapan natin, planuhin natin, isulat natin, at gawin natin. That's how things would happen. Systematically.
Kaya uso po ngayon sa ating mga government agencies yung National Technical Working Group kasi doon daw sila nag-uusap-usap, no? If there's a One Health and a National Technical Working Group in the Philippines, baka that will be the venue, di ba? Kaya na uso ngayon sa mga
yung FEP-SDG, yung Philippine, FEP-SDG is going to meet on April 3.
Mhm.
We're looking forward to that. It's after the pandemic, that would be a big meeting. The DOH is now the chair of FEC, and it's even the secretary, OIC secretary Vergere would be conducting, or would be the one to actually preside over the meeting. So this is something to look forward to.
Ayan. Maganda yun. Very interesting din po, sir, yung nabanggit nyo kanina about yung animal case initiated risk pathway, tapos yung kabaliktaran nun na human case initiated risk pathway, no? Lalo-lalo na siguro dun sa mga households na may mga alagang sarili nilang mga domestic pets, no? Tinatawag natin. Kasi ako in particular, meron kaming 2 dogs at 2 pusa. At so yung sinasabi yung animal case initiated, human case initiated, hindi po namin alam yan because we are dog lovers and cat lovers. Nag-aalaga kami pero hindi po namin talaga alam yung how to prevent kung sakaling baka mamaya, or hindi namin alam baka mamaya itong sakit na meron ka or skin diseases baka nanggaling dito sa ating aso or sa ating pusa. Wala kaming alam na gano'n. Saan po ba yung agency na dapat naming, kumbaga makakakuha kami ng more educational information on that?
Well, yung mga agency naman natin, once the disease is identified or it's been prevalent or indigenous or what you call, yung endemic, no? They have their programs. For example, rabies, no? Rabies. Let's take that as an example. Yung agriculture actually is responsible for, I guess, managing dog rabies, and then health, of course, supporting agriculture as well as managing yung post-exposure prophylaxis, including pre-exposure prophylaxis in some ways. We have a lot of information materials and education materials, no? Communication, risk communication materials, and rabies has been there. I mean, in the start of my career, I worked with RITM. We started the rabies laboratory there. It's been around, and then there's such thing what we call 0/30, no? 0/30. We expect rabies to be eliminated 7 years from now because 0/30 is 2030, and that's really initial target was 2020. Now, ambitious ba yun? No? In 7 years, would we actually eliminate rabies? Now, yes, the sectors are working. They're trying to communicate. But in simple terms, hindi naman lahat ng aso or hayop ay nakakahawa. That's why we have pets. We can eat animals because we know that they are disease-free. There are regulations in place to actually ensure food safety and make sure that the meat is inspected, and markets are regulated. So meron tayong mga basic regulations na ganyan. But let's talk about I'd say wildlife markets that are poorly regulated. Poorly regulated yan. Local markets that are poorly regulated, napaka-porous. Hindi natin nare-regulate yun. Because nga may mga factors, drivers like poverty. Where there's poverty, there would be not some, but many issues, many problems that
health-related.
That are, multiplying. The multipliers of problem. Poverty is a multiplier of many other problems.
Yes. Wala pa ako nakikitang naka-raise ng hand. So, actually,
Dr.
it's
Maala.
fine.
My best friend, Dr. Maala.
Yes, Academician Maala. Yes,
Dr.
sir.
Maala.
Yes, sir.
Good afternoon, everyone. Doc Noel, Dr. Noel, kasama ko dati yan when we were forming yung laboratory animal science, di ba, Doc Noel? Yung group. Mhm. And dito tayo sa communication, how to communicate effectively. I think I have one recommendation or solution, unsolicited, of course. And I think dito sa One Health, would it be nice if we will involve or get the service or services of local government units? Kasi sila yung with the people most of the time, and I'm sure yung mga people in rural places are more comfortable with local government officials or government, and in that way there will be more effective channel of communicating itong mga zoonosis at saka yung mga spillover na ito sa mga tao. And in this aspect, we should train these local government units or officials how to communicate effectively. Using language or dialect or what na madaling maintindihan ng mga tao. I've seen a lot of brochures or pamphlets or what on diseases or what, and madami pa rin ay written in very technical terms. And I think that is not 100% effective in communicating topics like this one, zoonosis. So I think that is my comment or suggestion, unsolicited, of course. Thank you. Hi, Noel. Punta ka naman sa college, namimiss ka namin.
Oo nga, gusto ko nga po. Thank you for the invitation.
Thank you, Academician Maala.
You're welcome.
Academician Maala, I think you know those are very important. I would just say I think the most important point there is the local government unit, communities. We cannot keep on strengthening national lang or regional. We need to really focus on how, the more innovative ways on approaching local government organization, management, capacity, not just for help, but I guess the whole idea of, this is a sustainable development goal forum, SDG. That whole sustainable development agenda is so important to, and One Health is actually just part of that, but a lot of those aspects, sustainable development goals, are actually relevant to One Health. And the local government, nothing will happen effectively if we cannot strengthen the institution at the local level. This is institutional, workforce-wise, capacity-wise, not just, capacity meaning technical, yung seasoned, I will ask you later kung ano yung meaning ng season. One Health is not going to be effective kung hindi seasoned yun. Actually, nothing will be kung hindi seasoned, right? Literally, seasoned. One Health is important.
Thank you, Doc Noel.
Thank you, Doc Mala.
So much. Meron po tayong dalawang LGUs dito. Kanina nakita ko LGU ng LGU ng sa Nueva Ecija. Meron akong nakita diyan kanina na nakikinig sa atin, and Aliaga, Nueva Ecija, and also from Batangas. So baka kung magkaroon sila ng interest, they may contact you, Sir Noel. Anyway, so, lumampas na tayo sa oras. Kulang na naman tayong oras. Kailangan talagang magkaroon na naman ito ng part 2.
Sagutin niyo muna yung season.
Ay, season! Ang alam ko po kasi lang na season, so, sabi niyo acronym yun So, SEA, SONED. Mahaba yun hindi ko po alam. Okay. Siret na, sir. Siret.
Okay, for the sake of time management.
Sige, at iti-take note ko yan. Season.
S, of course, giveaway, science.
Of course. Science.
E, another giveaway, ethics.
Ethics.
A is another giveaway, arts. Without science, it has to always be paired with arts.
Art.
And then,
Another S.
Son, right?
Opo, son.
Socio-political oneness.
Social-political oneness.
S-O-N-E.
N-O.
May natirang D. D na lang natitira.
Ano po?
Ano sa tingin nyo? I'll give you 5 seconds. What is D in season? And
Development?
I'll be surprised kung mag-guess to. But it's also a giveaway to a certain extent because we are a Christian nation.
Ang hirap ng ano.
So 1, 2,
Devotion.
3,
Devotion daw, sabi ni Sir.
4. Close.
Dedication. Dedication.
Yeah, in a way, I guess it's close, but what's another word for God?
Divine.
Divinity.
Okay.
Now, you know, in the United States, in the dollar bill says, and sometimes we are embarrassed or hesitant to proclaim that we do trust God. Maybe God is the secret to us working jointly. It's really a matter of being able to tell each other, oh, you know, I need you. I need to work with you. I want to work with you. And that kind of humble way of relating with each other, just a simple way of saying, I love you, you know. I do this out of love. So that D is actually divinity is actually also standing meaning to love. Without love, nothing will happen. Without love. So I guess that's my last comment. And
what a way to end our SDG Action Hour for this afternoon. And we are assured that the reason why na pinabigyan mo kami this afternoon, Sir Noel, is because of love. Your love for humanity and your love for the earth.
That's a take home po yun. Yeah.
Ayan. Thank you so much, sir. I hope there's going to be a second round of this. And maganda na kung makakatulong kami, sir, kung paano kayo mag-reach out sa mga LGUs, sabihan nyo lang kami. Dito kami ni Dr. Cruz and all the other academicians. So, thank you so much, sir. And maraming salamat sa mga guests natin. And this will not be the last time. So, thank you and hope to see you again next Friday. Thank you so much.
Maraming salamat.
Miranda. Thank you.
Dr. Luli, thank you.
Ay, maraming salamat, Noel.
Thank you.
We need to reach out also to yung mga traditional health workers, indigenous tribes,
Yeah.
Ayun, universities na mga suggestion ni Sir kanina, Ma'am Luli. We have an University Action Network that
our social scientists, yung mga social scientists po natin, importante po sila.
Yeah.
Not just the medical, not just the vet, not just the doctors, but the social scientists.
For the community outreach, the social scientists are very important.
Other sciences, engineering.
Yes. Maraming salamat, Sir
Thank you.
Thank you.
Yeah, maraming salamat.
Thank you.
Bye.
Bye-bye po. Okay, Aaron and NAS Advisory, thank you so much. Maraming salamat.
Maraming salamat.
Oo, ang ating video. Ayan.